really sets our mothers up for some stress because statistically, for first-time mothers, most of them will go 7 to 10 days post-dates. So today's topic is going post-dates. What is this myth about the due date and all this drama about you're being overdue? So first of all, Michel Odent, who's this very famous obstetrician who speaks globally, he's tons of research in maternal health. He has a quote that says something like, not all of the fruit ripens at the same time on the tree. So this due date that we have, it's this 40-week due date thing. It really sets our mothers up for some stress because statistically, for first-time mothers, most of them will go 7 to 10 days post-dates, which is totally normal. So a normal gestation for a mother is from 37 to 42 weeks. In terms of midwives and out-of-hospital birth, that's our window. We can catch babies out of hospital between 37 and 42 weeks. So we don't even start thinking about when this baby's going to come or starting to get a little bit nervous about trying to encourage the mom to go into labor until we get to like 41 weeks and 5 days. Right? Then we're like, oh, it'd be kind of nice if you went into labor tonight. Of course, this is all assuming we have a healthy mom, we have a healthy baby, we have a baby that's had good fetal movement, and we do post-dates testing, right? So we're not saying that you should just, continue with your pregnancy without any testing and without any ultrasounds or anything. Here at the Santa Clarita Birth Center, we have a protocol that all of our moms, starting at 41 weeks and 2 days, start their post-dates testing protocol. And that means we send you in, we do an ultrasound to check amniotic fluid, we check variability with the baby's heart rate, we make sure that the baby's doing well in the environment. And we repeat that test every 2 to 3 days to make sure everything is staying normal and that there is no medical indication for an induction. Standard of care in the United States is 41 weeks, is 41-week mark. So most of our moms are, they're pretty chill until 41 weeks. They get to the 41-week mark and then they all have a come apart on the couch and they're crying, and family members and friends are all stressed out. Oh my gosh, you haven't had that baby. I can't believe you haven't had that baby. That baby's getting so big in there, right? That's not really how it works. That baby's getting so big in there. How do you know the baby's okay? Have you seen a real doctor? Because my doctor wouldn't let me go past 41 weeks. But what we have to remember is that the body works perfectly, right? The body knows when to have the baby and the baby knows when it's time to come out. And there are a lot of things that are happening at the end of the pregnancy there that baby is optimal fetal positioning, right? That baby is rotating to get that head in the perfect position. We correlate it to the key being in the lock, right? So we can push this and jam the key, trying to get it into the lock, and it doesn't quite fit, right? That's the head in the pelvis. But what happens at the end of the pregnancy, that little baby head is squirming around in there, trying to get in this optimal position, which will trigger the whole system to get going, and then the body goes into labor and we have this baby that's perfectly aligned, and you have a normally, progressive labor. I have a story. One of my family members was having her second home birth, and she was edging on the 42-week mark. She was like 41 and something. I was not catching the baby. She lived in a different state. And, there's a lot of pressure. The baby's getting big, the baby's getting big, the baby's getting big. And I was like, just chill. Don't worry about it. The baby's going to come out. Don't be doing any herbs. Don't be pushing this baby. You don't need vaginal exams. Let the baby rotate to this optimal position. And she did. And I think she went into labor probably at 41 and 6 or 42. I don't exactly remember what the day was. But she went into labor, this big old baby. I think she had a 10-pound plus baby. Delivered spontaneously and quickly at home once he was in the perfect position, especially when we're looking at these big babies, right? These big babies really need a lot of time to get into that optimal position. And when we induce them too soon, when we get really anxious and we try to push this labor, we sometimes encourage this baby into the pelvis in a position that is not optimal. And that's when you hear about, well, my doctor didn't let me go, so I went in at 41 weeks and they did the suppository and then they started the Pitocin and then the baby went into distress and I wound up with a C-section. Sometimes those are real, right? We do know that certain women do need C-sections and not all babies tolerate labor, but a lot of times when we're pushing this baby into labor at 41 weeks, it's not really ready yet. But when we're patient, and as long as the environment is okay, there's no medical indication, there's enough amniotic fluid, the baby is reactive, everybody seems to be doing fine, we need to leave the mother alone and let her and her baby go into labor spontaneously, right? We know that we have better outcomes for that. And we know that statistically you're going to deliver before 42 weeks. I mean, I can count on one hand how many women went beyond the 42-week mark. There aren't many, especially when we're working with good dates. We really know, maybe we did an early ultrasound to confirm that our dates were good. We have a mom that was tracking her cycles and she really knew her dates. You know, we were working with really good dates. It's really unusual to go past 42. But there's no line in the sand that's like 40 weeks and 6 days, your baby is fine. Suddenly at 41 weeks, the baby's not fine. I mean, it doesn't really work that way. We're diligent with doing our post-dates testing. Mom is really checking in with fetal movement. Everything seems to be normal. Leave it alone. You will go into labor. So that's it. And things to get you into labor, right? When we start to get to that 41-week mark, mom's anxiety levels, they start to rise, right? Your cortisol levels start to rise. Your adrenaline is rising, which inhibits oxytocin, which is the hormone that causes you to contract. So the more you try to get yourself into labor, probably the less likely it is going to work. So we encourage you to go watch a yummy movie, cuddle up at home, do things you really love to do. And what you need to remember is that those last days of your pregnancy, although the days seem like years and the time is just ticking by so slowly, really take a minute and remember that it is a magnificent time. You are never, ever going to have that baby in your belly ever again. And it is just a really, really special time for you to remember to connect to that baby. And soon, that baby's going to be outside of your body, and which is great, and we can't wait to hold our babies. But one, you're never going to be able to do the things you're doing right now with the baby inside your belly. You can't hear them cry, and they're portable, and they're instantly fed, and it's very easy to manage a baby that's inside your belly, especially if you're a first-time mom. Careful what you wish for, because after that baby's born, about day 10, we're really wishing we could just put that baby back inside our body just for a little while so we can get some sleep. But what you really want to remember is those last few days are so special. And to really reflect, really take the time to sit with that and remember that this is a gift you have, and you're never going to have that baby inside your belly. You're never going to have that baby all to yourself anymore. You're never going to feel that baby move and kick inside your belly. And instead of rushing and wanting to get to the next place, which of course we all want to hold our babies and see our babies and we're really excited, but don't wish this time away, because you're never going to have it. And then before you know it, your kids go off to college. My next one's about to go off to college in a few months. And it's like, wait a minute, I remember when he was inside my belly. And so just a little anecdotal story. And then I don't know if anybody has any questions or not, but little anecdotal story about if that baby stays in there, it's going to get too big, how that's not really a thing. My first son was like 41 and 5 days, and typical first baby, long labor, and he was 7 pounds 4 ounces. And then my second baby came on his due date, and he was over 8.5 pounds. He was, he was a big guy for me, and he gestated a shorter amount of time. It's just, you're going to grow the size baby that you're going to grow. A baby isn't going to stay in your body because, they can't come out unless you have a medical condition. We're talking about normal pregnancies. We're not talking about diabetic mamas. We're not talking about other issues. We're talking about normal progressing, low risk women. You're going to grow the right size baby for your body, as long as you're eating well and you're doing all of those things that we talk about all the time in our prenatal care. You know, you're eating clean protein, you're getting your greens, you're limiting your fast foods and your refined foods and your simple carbohydrates, right? You're limiting those foods that are going to grow these babies that might be too big for your body. You're eating really well, you're walking every day, and you're living a healthy lifestyle. You're going to grow the right size baby for your body. So the most important thing is, remember it, it's a really, really special time to have that baby inside your body, and don't wish it away. So your due date isn't a magic number. Plan on 2 weeks after that. Statistically, first-time moms will go 7 to 10 days post-dates, and boys gestate longer than girls. That's just the way it is. So that's my little 2 cents. Oh, and I have a little secret. So everybody, you know, you have this baby inside your body, and
keep your boots on, Renee.
I'm going to reveal my boots. So you're all going to rock your post-dates pregnancies like a gangster. Because you have a little secret inside your body, just like I have a little secret inside my boot.
So Renee,
I love my gangster socks.
So Renee, in conclusion, we had one question come up about how accurate due dates are.
Yeah.
And in the interest of time, maybe we'll table that question and take that on next week.
Due dates are guesstimates. Your due month. You're due within 5 weeks of that due date, and it has so many variabilities. So any questions, just write them in. We're checking our Facebook page and we're answering those questions. And there you have it.